And action. Hey everyone, it's DrRic. Joy had a question about sleep and insomnia. So, and this is a really common topic. I see it in the office quite often, and it usually has an aside. I'll get my history, my integrative medicine history, and usually I'll find out about sleep. The first part of the social history is to ask, what time do you get to bed? What time do you wake up? And then if I hear, oh, I only get up once a night, doc, I sleep deep, I sleep fine. And then I ask, well, do you wake up refreshed? And usually more than 60% of the time it's no. And usually there's coffee that's necessary. So if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. I thought I'd do this because I was fading off and the alert button's huge. Anyway, sleepy but not sleeping. So, I will always tell you the truth about me, and I fell asleep while driving twice. First time was the first residency on-call night that I ever did, driving home, and it was busy. It was in Philadelphia with University of Pennsylvania Presbyterian Hospital, and on-call was terrible. I just came out from research. I did research in Northwestern University for a year, and I got this spot. It was a transitional residency spot, and the first night on call, it was terrible. I mean, I've had worse calls in the Philippines when I was on surgery, but as a medical student, but as a resident, it was really taxing, and I drove home after sign out the next day, which was 5 o'clock the next day. So I was in work about 6 a.m. I stayed overnight, didn't get any sleep, continued to work the next day till 5 p.m. the next day, then I went home. Well, I used to live at my parents' house, and it was about a 30 to 45 minute drive. I fell asleep right before I got on the Ben Franklin Bridge, and I hit a car. I must have been going 60 miles an hour. I hit a car, I approached a traffic light, I didn't stop. Luckily, I only hit one car. And wouldn't you know it, that guy was a resident at University of Pennsylvania. He was a neurology resident, so I didn't kill anybody. Probably could have. Second time I fell asleep was during fellowship, my sports medicine fellowship, downtown Chicago. I did an all-nighter to prepare for a presentation, and I fell asleep driving there. My little tiny car, I totaled a tow truck. I had a 4-door Sentra, totaled a tow truck. And I just woke up right before impact. Those are two falling asleep at the wheel incidences that it will hopefully never happen again, but it was fatigue. Now, I keep a regimented sleep pattern. I try to wake up at about 4 o'clock to 4:30 now. Every day, try to get to sleep about 9 or get wound down at 9. And hopefully I'll sleep all night. I usually will not have any fading off in the middle of the day. I also do fasting at this point, so I don't eat until about 11. So most of my fuel when I refeed at 11 is high quality. So I think it's one of the reasons why I don't fade after that. But one of the things I used to remember is when I was first in my first year of private practice with Central Page, I thought it was bulletproof. I used to eat any kind of thing I would want. That was when I ingested McDonald's steak, egg, and cheese burgers. Or bagels. That and large coffee with 10 packs of sugar would get me through the day. With little sleep, and I thought I'd be able to exercise. I used to do indoor triathlons, stuff like that. But it's not healthy. And I think that's the plight of the average American, the average patient I see, is we go through times of life when, sleep is a luxury. And you have to work. You got to get the kids to school. You have no choice, especially if you're a single parent. And the kids, you have more than one kid and one of them stays up at night, the other ones have to go to school. You have to, as much as possible, stay awake for the one, but stay awake at night, but then stay awake during the day for the others. It's terrible, and it's usually draining, so you catch restorative sleep when you can. But if we can prevent it, then great. One of the options I have is the majority of my patients do have, Joy included, do have triggers that initiate poor sleep quality. And then if you embrace and reinforce that sleep problem that occurred only one time, 2 times, maybe a week at the most, if you keep on reinforcing that, it becomes a rhythm. And then your body remembers that rhythm. Your body has a natural time clock. There's 2 time clocks, and I've talked about it in other videos. I'll put the links down below. One time clock is the brain. The brain knows when to wake up, approximately, and when to go to sleep. And there's a slight variation if you're a night owl, but most Americans are not night owls. And I have a reasoning. My thinking is that night owls were there to protect the herd when everybody else was asleep, especially for predators at night. Anyway, see my video. But most people will go to sleep easily when nightfall falls and then wake up when sunrise starts. The problem is there's TV that's available 24/7. There's food that's available 24/7. I think because of the high stressors, we have to have coffee during the day, and coffee during the day in the morning up until 12 can still affect your sleep at night. It's a stimulant. And alcohol at night, which helps as a depressant. It's an excitatory chemical at first, but after that it's a depressant chemical. But it helps people kind of lose inhibition and get tired. The problem is, it'll make you sleepy, but it will also cause other brain calming things that will work temporarily, but when the alcohol is out of you, which is usually about 3 to 6 hours, then you wake up middle of the night with the same problem of overexcitement and frustration and stress that you did before you had your first drink. So the option is have another drink, which isn't wise. And if you don't wake up because of that, because of the high stress, you'll wake up because you have to pee, because alcohol is a diuretic. So it's not a good idea. So what I wanted to do is talk this time about medicines. There are medicines that people can use over the counter. I love the herbs that are available to us out over the counter. If you just have insomnia, you're trying to reset your rhythm, again, see my video down below, DrRic tutorial, Reset Your Clock. But there are herbs like 5-HTP. 5-HTP is 5-hydroxytryptophan, and its a basic component. Tryptophan helps you build more serotonin. If you build more serotonin, you calm. And calming, especially with like 100 milligrams of a reliable source at night, will help you, if everything else is in place, go right into sleep. It'll help the brain fade right into sleep. Now, if you cool down the room, cover your eyes or shade your eyes from light, cover your ears, get into a comfy bed, turn the temperature down, and yet you have a partner that snores or a neighbor that's playing a guitar really loud, you're going to be frustrated. And you have to try to do as best as you can to eliminate all those other stressors and just prevent the waking up of the middle of the night. And 5-HTP is something that will slide you in. Another thing that also slides you in would be melatonin. Melatonin is a hormone that's secreted by the pineal gland in the brain, right in the middle of the brain. And when the eyes are a direct extension of the brain. Eyes are brain tissue, technically. And when the brain does not see any sunlight or bright light available in the environment, it says, oh, must be sleep time, have to go to sleep. So it starts to wind down, starts to slow the brain waves. Usually when you're listening to podcasts like this, the brain waves fire off a beta wave. That's kind of like a lecture. When you get bored, it becomes alpha wave. And as you get bored and more tired, it goes slower and slower and slower. That's the way the brain works. Now, if you're constantly fighting with somebody, then you're always beta. Even after you get to bed and you just calm down your fight, you're still beta wave, and it'll make it hard for you to go to sleep. That's why melatonin, when you spray it, I like the spray bottle, because if you have to use it in the middle of the night, you don't have to take any water. Remember, water with a pill even will eventually make you want to pee. So I say if you can avoid the pill, great. There are some great brands out there that are 2 milligrams, maybe 3 milligrams. I wouldn't go higher than that, although melatonin has an off-label use that you can use it at high doses for fighting breast cancer, like 20 milligrams. Although, again, if you want to use melatonin at night, really lower than 2 milligrams is probably perfect. Again, the spray I like because you don't have to get up. You can actually be lying down, reach over for the spray, spray it in your mouth, do the breath exercises, let it sit in the tongue, and then swallow it after a while. And hopefully it affects you. Gives your body a wave of melatonin, gives your brain a wave of melatonin, and if you can fool the brain into saying, wait a minute, the brain's going to say, I just got a hit of melatonin, it must be time to sleep. Boink. So hopefully it calms down too, or slows down its brain waves. Other things that help with nighttime, magnesium. I think if If you look at the Midwest, I think most people are stressed out. When you're on stress, the body has to get used to fighting, at least fight or flight. When it does that, usually there is a little bit of an extraction attempt out of the bone for magnesium, because you need magnesium to move, you need magnesium for muscle and to pump the heart. And when you're under stress all day long, magnesium is constantly pulled out of the bone, and then it's pooped out or secreted out into pee. So usually we're magnesium deficient. Now, although most of my colleagues don't check for that, I think it's important. And I usually want to get to magnesium levels, RBC magnesium levels, into the 6.4, 6.5 range. As long as you have no kidney problems, you can push it. The biggest thing with magnesium as far as the toxicity is you're going to have to poop. So watch for the cheap magnesium. I don't like oxide or cal. I like magnesium aspartate is my favorite, maybe malate, maybe glycinate. The other ones like oxide are usually cheaper and make you poop, if anything, but they don't help the brain. L-threonate's great too because it has a calming effect. It supposedly gets through the blood-brain barrier fast. So MagMind is a nice one that I use for my patients to initiate sleep. Again, if you're using magnesium, try to use it about dinner time or a little bit thereafter. And if you have a big amount of magnesium in the bloodstream, if your brain is ready for it, it'll help it get into sleep. Now, there's other things too that also help with sleep, but those are the top three. As far as over-the-counters, people use Unisom. They sometimes use Benadryl, diphenhydramine, or allergy, Advil allergy, Tylenol sleep, I think it's called. All those things with sleep or allergy have Benadryl. They have diphenhydramine. Diphenhydramine is an antihistamine. Antihistamines have been known to make you sleepy. The only and it'll help my older patients get to sleep because it's over the counter. But the problem with diphenhydramine is, as an antihistamine, it'll make you sleepy. I do not think that it affects the quality of your dream state. You have to dream. You have to have at least 6 to 8 REM cycles, REM, hits per night in the brain to feel refreshed in the morning. The problem is the Benadryl in most of my older patients will usually have a leftover effect in the morning when you wake up, a little dizzy, a little tired, or a little dry-mouthed. I took Benadryl for a while just to push it and try to get some sleep, to reset my sleep rhythm, and I remember having dizziness in the morning after a couple months, so I stopped that. So aside from the Benadryl over the counters, then we go to the prescription medicines. Prescription medicines like Ambien, Sonata, Lunesta, they're all sedative hypnotics, and they do work to initiate sleep with the brain. The problem with them is they might have the same, they shouldn't have the same effect as like Xanax or Valium will on your dream state, and we'll get that in a second, but they will have the same effect as far as Benadryl in the morning, making you sleepy. So Ambien, which is Zolpidem, or Sonata or Lunesta, you have to be careful. They do initiate sleep. I think it's a nice rescue if you want to reset your rhythm, but to rely on that for the long run, I wouldn't. Again, if there's fatigue, dry mouth, dizziness, you have to deal with, it's probably from the medicines. And if you truly have to use that medicine in the long run, you should really figure out what is the root cause of the sleep problem. If it's a stress issue, take care of the stress. If it's a sleeping partner that snores, well, sleep in a different room. If it's something else like anxiety, then take care of that too. But again, it's a nice medicine, but there are some side effects when you use those sedative hypnotics with other medicines, and we're going to talk about that right now. People like clonazepam, people like Xanax, some folks like Klonopin's clonazepam, Valium, and they're all benzodiazepines. And benzodiazepines definitely make you drowsy. The problem is benzodiazepines, of the ones I just mentioned, will make you sleep, but they also cause a behavioral addiction to the medicines. When I think actually Sonata, Ambien, and Lunesta will also cause a behavioral addiction to them. But for sure, that's what I think, but for sure benzodiazepines do that. A lot of people will become, will have the total reverse symptoms if they don't have their medicine on time. And that's why I think the addiction is there. But they also, here's the problem, they make you sleepy, but they screw up REM sleep. And again, if you look at my other videos, I'll try to truncate it, but when you get this sleep, the brain waves slow down, and when they slow down, they go through different stages of sleep. 1, 2, 3, REM4, then 1, 2, 3, REM4. The brain goes in and out, about 6 times. I think that's a built-in mechanism to beware of predators, because we don't all match up our REMs, and if something sneaks up on us on the campfire, if one of us is coming out of sleep just enough not to actually wake up, but a little more alert in stage 1, we'd be able to hear the crackling of the branches as something approaches us, or smell the fire, versus everybody, all humans, being in REM sleep for 6 hours. So kind of like a bear. If a bear hibernates, you can even touch it and get into its den, it won't wake up. In fact, the mama bear won't wake up while the cubs are feeding for several months, and that's just hibernation. So we can't do that. The bear can do it because they're predators. We can't do that. We are technically omnivores and prey. So that's my opinion. So the problem with the benzodiazepines is that they rob you of REM sleep. So if they do get you to sleep and you do wake up in the morning, you actually will have the feeling that you didn't dream and you didn't get refreshed in the brain. So again, fatigue, dizziness will be side effect there. In addition to those medicines, also interacting with the sedative hypnotics if you use them, or psychiatric medicines if you use them. And that's what the next thing will be. And alcohol too. So the next thing will be medications like trazodone. Trazodone, these are the psychology or psychiatric medicines that are used for off-label use. So most psychiatric medicines like trazodone are for depression. Sometimes that's what the book says that the FDA approved the medicines for, but psychiatrists and primary care doctors and neurologists and sleep doctors will use some of those medicines as an aid. Even though you don't have anxiety or depression, or you just might have a hint of it, they might use that as an aid to initiate sleepiness. Trazodone's a nice one. I use it for young people, especially high stressed or a little bit depressed patients. And trazodone is supposed to be an antagonist for serotonin receptors. So in a roundabout way, it increases your serotonin level. Again, remember I talked about 5-HTP. Have enough 5-HTP, that means you have enough serotonin. If you have a lot of serotonin, calm. So trazodone, or even the other ones that you will probably be aware of are Zoloft, Paxil, Prozac, Lexapro. Those medicines are not for sleep, but I've seen some psychiatrists use that at night to initiate a sleepy effect. The problem with those medicines is, well, even if it's off-label use, a massive weight gain and also fatigue the next day. And plus, when you have serotonin that hits, it doesn't just hit when you take the pill. Serotonin stays high all day and it makes people kind of flat. I took Zoloft for a short time in my early fibromyalgia days, and it helped me get out of my struggle, but I remember just I had all the side effects in the world, and I was just very bland. I thank my psychiatrist for giving it to me, but if I can avoid it, now that I have all this knowledge about herbals, I would. So another one I'm hearing a lot of psychiatrists using nowadays is Seroquel. Now Seroquel goes the next step. It is an antipsychotic approved by the FDA for antipsychotic medication. And I've seen some doctors use it for sleep, and I'm thinking, holy crap. They're using these big gun medicines and not even doing the fine tuning of adjusting sleep habit, circadian rhythm, turning down the temperature, all the basic things. Not eating too late at night, trying to give maybe a dinner that's more healthy carbohydrate dominant than protein dominant, which is another way to initiate sleepiness. And they're just going for these big medicines for off-label use. I can't say I agree with that, but at the same time I see that a lot of patients are seeing psychiatrists for a multitude of other issues. Maybe they're trying to kill two birds with one stone. I don't know. As long as they're not trying to kill my patients, I guess that's okay. But it's not my place to stop the medicine a specialist gave, but I tell you what, I'm going to add to it if there's an issue. And usually you're not going to have too many side effects with the big gun medicines and those herbs I was talking about. Even something like ashwagandha at night would help. But again, it's up to the integrated medicine doctor to kind of know the prescription medicine effects and know what's going on with the patient, and maybe look for deficiency and see if you can kind of meet halfway. I think there's great results with breath exercise. Mindful practice at night but most Americans are not willing or feel that they're on the defense when I say, do you have any mindful practice? Do you ever see a psychologist? Usually the answer immediately is, well, I don't need a psychologist. So I take it as patients feel offended when I ask them if they've ever seen a psychologist. But when you know what a true psychologist can do for you and how they can develop, they're your coaches for developing mindful practice to neutralize stress. To say you don't have stress is a lie. I think all Americans have it. We might not recognize it, especially my CEOs or business owners. I think you just have to realize it and maybe try it. I just did a video on orgasmic eating. I explained how serotonin at night works, but with food or orgasm or sex or love. So we want that at night. And that leads to my last thing. So when you're using prescription medicines, you can't just stop. You have to get the opinion of the guy who prescribed it, and maybe the opinion and plan for an integrated medicine doctor. But there are other medicines that also, for blood pressure, cholesterol, reflux, that also can be used properly. And sometimes you have to take certain ones in the morning, switch over from nighttime to morning. So you should ask your primary care doctor about that. I can always give you a prescription. Controlled substances are fine. Medical marijuana is great. Again, you have to be approved for that. In the state of Illinois, I think we have better quality medical marijuana than Colorado. That's what I hear. And I think it's great if we can take advantage of it. The only problem is the smell, especially if you smoke it, or even the vape smell. Sometimes edibles take a little bit long time, but I'm also the one to guide you as far as how to use medical marijuana if you do have that option in the state of Illinois. The opposite end of the day too, I think we can also use, if you're really tired, B12, cyanocobalamin or methylcobalamin. B12 is an excellent stimulant. A lot of us are deficient in B12, whether you're a meat eater, a keto practitioner, or vegetarian. I think we all lack B12. If you jack up B12, it's kind of like magnesium. You can't really have toxic effects, but and now I think we're evolving to find a lot of people have MTHFR deficiencies in gene deficiency. So even if you do take a little B12, it probably doesn't get in. And those of you who are on omeprazole, Prilosec, Protonix, Nexium, those medicines are great for reflux, and you should see my video on reflux if you have sleep issues, because they go together. But those medicines also rob you of B12, which will make you sleepy too. Make you sleepy during the day, might not make you sleepy at night. So always things to take advantage of, whether it's at night, whether it's in the morning to wake you up, rhodiola, other things to, sometimes D-ribose powder. Some things can make you awake to get your circadian rhythm back into play. Some things will make you sleepy, but I think overall, Joy, there's a whole bunch of things that we can do to manipulate this sleep habit and try to rock it back into a regular rhythm. Don't feel stressed out. I know it's easy at 3 o'clock in the morning to say, I can't sleep in again. But if we just figure out the root cause, try to reverse the root cause or the problem, then you should be able to get back into it. It takes a little bit of time. You have to, I think 3 weeks of doing the rhythm again and again and again will rock the circadian rhythm back into place. You can't ignore, again, there's eyes that also work to get the rhythm down, and the stomach or the digestive system also works to go in sync with the eyes, so that you have both the stomach or the digestive system and the brain or neurological system together, noticing and acknowledging time to sleep, also noticing, acknowledging time to wake up and time to eat. So good question, Joy. For the rest of you, if you have any comments, put them down below. Otherwise, I will see you in the next clinic.